Welcome to part 2 of the Introduction to Acupuncture video. I'm going to concentrate on the acupuncture-based filigree stimulation. Dr. Chen in his video explains several important items that first-time patients need to be aware of. First, do not be at an exhausted state before acupuncture. If you had put an all-nighter playing video games, it may not be the best time for acupuncture. Make sure your body is well rested. Your body should be prepared with relatively strong and sufficient qi and blood, so as to receive maximum benefit as well as to cope with acupuncture stimulation. Number 2, please eat something light an hour or two before treatment. Empty stomach can cause potential hypoglycemia, which may lead to dizziness during acupuncture. I think the reason behind above 2 items are really easy to imagine. Let's say if you were a general and you are commanding lots in qi and blood or oxygenated blood with repairing soldiers to come to the site of acupuncture to heal your ailment, the moving of nutrition and blood may in turn cause temporary lack of the qi and blood elsewhere. So if you're already weak, tired, and haven't fed yourself, you will not get the maximum benefit from acupuncture as there is just not enough qi and blood to go around for everyone. You may even feel a little dizzy as you are moving and redistributing too much qi and blood away from one site and to another in an already depleted body. So in some cases, strong individuals can also have needle dizziness. This is mainly due to nervousness. If a patient is high-strung and very nervous, his emotional affect his body and he may become too sensitive and overreact to needle stimulation. This usually happens in men who are overly fearful of being needled, in which case needle dizziness can be avoided if the practitioner does a good job of communicating, explaining and counseling in advance, and put patients at ease about their treatment. During first acupuncture treatment, your TCM practitioner will take this into account and they will use very thin needles, very gentle stimulation to help their patient to overcome any psychological pressure and to help body to adapt to future treatments. Needle dizziness happens very rarely and the symptom is similar to hypoglycemia or low blood sugar. If this does happen, TCM doctors and acupuncturists are trained and fully experienced to deal with this. However, we should still try our best to avoid situations such as excessive hunger or extreme fatigue before receiving acupuncture stimulation. Number 3, generally cleaning of the body and wear loose-fitting clothes. Many first-time patients are not aware that they may have to expose their feet for some distal acupoints. Of course, acupuncturists will never refuse to give treatment to any patients due to bodily cleanliness. But some patients may feel self-aware and subconscious. Clinics will always have gowns to change to. However, you may like to wear loose-fitting clothes that can expose up to the upper thigh area. Number 4, does acupuncture hurt? This is always the first question you patients ask. On our skin, the epidermis is rich in nerve ending as we use it to sense our surroundings, to feel and touch. It is, however, a very thin layer. So when acupuncture needle enters our skin, we may feel a very slight sensation such as mosquito bite while the needle is going through the thin epidermis. The dermis layer is much less innervated with nerve cells, so after a few milliseconds of mosquito bite sensation, patients should not feel pain. Rather, the sensation that we are looking for effective treatment is soreness, numbness, pressure, transmitted tiny electrical sensations along the meridian path or highways. TCM doctors call this de qi sensation, and it is a telltale sign that the acupuncture stimulation is to the point and is working properly. In some areas, such as our hands and feet, needles may hurt a tiny little bit more than other parts of the body, as there are more nerves on these areas where touch sensation are important. Also, erector pili muscles on the side of the pores are rich with nerve ending. Occasionally, these pili muscles get stimulated while needles are being inserted. In this case, all you need is to tell your acupuncturist and he or she will remove the needle and try to reinsert in another area, which is less sensitive. The phenomenon of the desired sensation is to feel soreness and numbness that is transmitted. Some are faster, some are slower, depending on the doctor and his or her manipulation for the condition of the disease. So in the process of acupuncture treatment, as a patient, you need to relax as much as possible. This will not only help you to have minimal pain, but also maximum benefit. Again, your acupuncturist will take into consideration of your first time and use gentle manipulation that you can accept. Number 5, can I take a bath after acupuncture treatment? After acupuncture, we recommend not taking the bath on the same day. You can do a shower on the same day, however, typically 2 hours after acupuncture or moxibustion. We recommend avoid taking a bath on the same day since your skin is very sensitive and sometimes a minute break in the skin may cause slight redness, swelling, and allergies. This does not happen very often, but it is an extra precaution just in case. Number 6, I feel tired after acupuncture treatment. Is it normal? The answer is yes. It is normal to feel tired after acupuncture treatment. This is because the stimulation of acupuncture points, you are mobilizing qi and blood to the area of need. This happens precisely because acupuncture and moxibustion is having the desired effect. They are redistributing and mobilizing the needed nutrition, qi and blood into a repairing mode. So your body is telling you to take a rest and preserve energy since it is working hard to heal. At the same time, we also need to take into consideration that the stimulation does not need to be over the range of your body's adaptation. So in TCM, it's all about balance, the Goldilocks scenario. Not too little, not too much, just right. So listen to your body and communicate with your acupuncturist. They will adjust the interval of your treatment accordingly. Practitioners typically will not acupuncture consecutive several days in a row, unless it is special case such as Bell's palsy or facial paralysis, as the cumulative amount of stimulation can reach a relative strong level. In clinical practice, the practitioner will evaluate a patient's constitution. If the patient is strong, the spacing between the treatment may be shorter. However, if the patient is weaker, the waiting time between the treatments will be a little bit longer. Therefore, most of the acupuncture treatments may be done every other day, every 2 days, every 3 days, or even every other week. Communicate with your acupuncturist and they will find the best interval for you. This is to achieve optimum treatment effectiveness and at the same time allow your body to recover and regenerate energy that it needs for healing. Number 7, last but not least, acupuncture needles does go through the skin layer. So even though the needles are hair thin, but there still might be slight bleeding in the local area. This is very normal, especially when the needle reaches small blood vessels. In this case, very slight local hematoma may occur. This should not be too much concern as the bruising will disappear naturally in a couple of days. In other skin surface stimulation process, such as scraping, cupping, and moxibustion, there might be slight redness at the local area of the stimulation. There could also be slight blistering at the moxibustion site. This is also normal, but as always, communicate with your practitioner for any concern and questions. It is also recommended that the patients receive acupuncture to rest 10 to 15 minutes at the clinic post-acupuncture to make sure no issues or discomfort. Finally, we would like to recommend that for elderly who are not very mobile, it is always a good idea that they are accompanied by a family member. I hope my video has given you a general idea on TCM acupuncture and help you feel more educated, comfortable, and more relaxed before your first treatment of acupuncture. In my next video, I want to cover what a combination of TCM acupuncture, moxibustion, and patent herb can potentially treat. As over 80% of the time in the States, patients are seeking acupuncture for pain relieving, often alongside physical therapy and massage. There are many other conditions that TCM treatment can yield excellent and long-lasting results. If you have any other questions, please leave comments below and I will try to consult Dr. Chen and get an expert answer for you. Thank you very much for watching, sharing, and subscribing. Again, I would like to remind everyone that I'm in the process of dividing my YouTube channel into 2 accounts, Beloved Way for Chinese native speakers and New Channel to my children for English speakers. I will start to work on the transition, so please subscribe according to your needs. As always, please note that this video is for entertainment purpose only. The video content is not intended to be substitute for professional medical advice, diagnosis, or treatment. Always seek advice of your physician and other qualified health provider with any questions you may have regarding a medical condition.